we can appreciate the coronal sections of the brain, and we try to be systematic in reviewing these. And usually the way I do that is begin with the outer structures and move to the internal structures. So we begin with the cortical ribbon. We want to appreciate it from the frontal lobes all the way through back. What we're looking for is integrity of that ribbon and kind of a uniform thickness, which of course is going to be a bit difficult and subjective because there's going to be knuckle cuts of the individual gyri as we go back. But in any case, looking for infarcts, which tend to occur in the depths of the sulci and would be manifest by the loss of gray matter. I don't see any evidence of structures there. Looking here, that looks good. We're going to talk about the ventricles in a moment when we come back to those. Here again, the cortical ribbon looks entirely intact without evidence of infarcts, which again would be expected in the depths of the sulci. Next structure to look at is the white matter, just underneath the cortical gray strip, and you can see that it's uniform in its appearance. We don't see any evidence of plaques like you might identify in multiple sclerosis. It's instead just a uniform white character separating the deep gray nuclei. The next structure, which is most easiest to see, of course, is the lateral ventricles. These ventricles are slightly enlarged. They're a little bit rounded here. In a younger individual, they would be more pointed, but here we've had a little bit of atrophy of the ventricle with some sort of rounding in the outside surface. Bulging into the ventricle, we can see the caudate here, or in this portion more anteriorly, the bulging of the head of the caudate and the underlying putamen there. Both those structures look intact. And I don't see any evidence. There's a small vessel there in this one, but I don't see any evidence of infarction in those tissues. If you follow the caudate back, it becomes smaller and smaller as you get further into the posterior portions of the brain. Up here, approximately a little bit behind the temporal lobe tips, one can identify the basal ganglia. Here we have the putamen, the globus pallidus, both outer and inner segment. And the inner segment, true to its name, shows prominent paling in its overall color. Here we can see the columns of the fornix coming down as part of the septum, and if we look and peel it apart, we can actually see the anterior commissure here in the middle of the third ventricle. The third ventricle ends here at the infundibular stalk, which we identified at the base of the brain when we did the initial dissection. Here in the lateral the mesial portions of the temporal lobe, one can identify the amygdala. It's really not almond in shape, but that's what it gets its name. It is relatively indistinct and looks just like a sort of a smudge of gray matter immediately adjacent to the lateral ventricle in the temporal lobe. Moving further back, we now have a lateral motion of the basal ganglia structures, and mesial we have the temporal lobe with a massa intermedia, which connects the two sides of the thalamus in about 80% of the cases. Here we can identify the red nucleus immediately below the thalamus, along with the substantia nigra and the crus cerebri that we cut off the rest of the cerebellum with. In the temporal lobe, in the mesial portion of it, we can identify hippocampal structures. They are immediately inferior and mesial to the lateral ventricle in the temporal lobe. One way of assessing atrophy in this particular organ is not to look for its decrease in size, but to look for increase in the size of the lateral ventricle in this area. And I do not see that in this case. So that's a normal